My talk will be on the establishment of the Regional Ethics Committee in Central Africa. As you know all, we said that the mosquito doesn't have barriers, and there is a need for us to have a common understanding of what is going to take place in order for all countries to bind to wherever this mosquito will be released. So here I will be talking to you about the experience in Central Africa, what we want to do in order to control mosquito and make sure that everyone, when the mosquito is released in one country, the others will not be afraid of this situation because they are already informed of what is going to take place. So before starting, as you noticed, there were no presentation from Central Africa, so I will take this opportunity to present myself, where I come from. I come from this organization, which is called CERSAC, which is based in Yaoundé and which covers 6 countries in Central Africa. So this is just the history of CERSAC, created in 1963, and now it is what we say the Ministry of Health of the Central Africa countries in the place. And so CERSAC is those countries, 6 countries: Cameroon, Chad, Central African Republic, Congo, Gabon, Equatorial Guinea, and these are and we are also working with other countries such as the DRC and Angola when it arises to some epidemics or emergency issues. So what our mission? Our mission are to do some public action, carry research, health promotion, expertise to stakeholder and humanitarian acts in health domain. So those are things that we do. And we also work on different diseases, HIV, AIDS, malaria, tuberculosis, you name them. So there are also vector-borne diseases on which we are working to make sure that we also address these challenges which are also affecting the community in the area. So we also do some support to national control program, supporting them in drafting their document, key documents, supporting them in revising the annual report, supporting them in doing some collection or even for capacity strengthening within the area. So the Regional Ethics Committee, which has been created, was created due to some weaknesses that were identified within the area. So there was no interns in the sub-region capable of reviewing multi-country research protocols, lack of qualified human resources to review protocols, need for harmonization within the area so that when a protocol is accepted within this area, every country binds the decision, and also for the accreditation of national ethics committees. So to ensure the mission of this ethics committee is to ensure that the ethical review of biomedical research involving human beings in the sub-region, to harmonize this. I think I already said that. Now, how do we go about to evaluate what will be sent to this committee? There is evaluate and advise and recommend changes to protocols. That's what it is the committee is supposed to do. Provide on request support for ethical evaluation of protocol for countries. Comply with international and recognized ethical standards. And advise government officials, inform and raise awareness among community on ethical and bioethical issues, promote ethical control, evaluation in the Central Africa region, and promote ethical research involving animal and human within the sub-region. I just want to say that Central Africa is one of the areas in Africa where there have not been much of this gene-drive, genetically modified studies, or maybe, which have been implemented in the area. So there is a need for us maybe to start learning from countries where things are now going on in order for us to be more in line with what is being done across the area. So the operating procedures of the CERSAC, which is the name of this committee, is guided by the Declaration of Helsinki and it's also guided by also different regional and international treaties that we bind to human rights declaration standards and guidelines in accordance with internationally recognized ethical principles. So for this committee to meet, this committee is constituted of 15 members, which are within the executive bureau, and they are from different nationality within the area. And during their meeting, they can invite resource person in the domain that is needed for this. And the quorum for this meeting could be met with at simple majority. If the majority of is met, they can just hold their meeting and then reach a decision. And if the quorum is not met, so they need to meet again within 7 days. So this is what I can say within the area. And there is what has been prescribed for this this committee is that they need to meet they need to maybe revise assess protocol quite fast. 1 month, 1 to 3 months is what is requested from them in order for them to give their evaluation. And for each general meeting, a report is drawn up by the General Secretary and submitted to the member of CERSAC for approval. For each research protocol, evaluation session minutes are drawn up by the General Secretary. An opinion issued by CERSAC on the protocol submitted for evaluation is brought to the attention of National Committee of different countries. So when you bring in a protocol for something which is going to be run in one country, and if this could affect the other countries are informed of this protocol so that they know that this protocol is being reviewed, and at the end they have the outcome of this review and if it has been accepted. So so this is just how you have to present your dossier in order for the dossier to be reviewed by the committee. So you need, what is very important here is ethical consideration within your protocol that need to be clearly presented so that maybe a clear and evidence, clear decision could be made on this, and so that you can have the outcome of your presentation, your protocol evaluation quite fast. So the normal procedure for the evaluation, assessment under normal procedure, is, you have assessors which will go through the protocol, and we also have accelerated assessment of protocols that could be done within the area in order for those dossiers to be reviewed and get the outcome. But this is just for not very pertinent protocol. So when it doesn't, it's not a clinical trial, when it's not a genomic or gen drive, yes, this protocol can go on. But if it is something sensitive, it needs to take the time that it has to take for us to be really assured that it will not be a problem, a harm to the community where it will be released. So to evaluate this, the scientific validity is one, the fairness, beneficence is another factors that is used for the evaluation of this protocol, voluntariness, confidentiality, informed consent, and participant safety are among things that we go through to maybe evaluate, to score these protocols in order for, So the decision that we make from this could be approved. This is no need, it doesn't have anything to do. It could also be conditional approved, not approved, does not require exact review if it is not really as, I want to say, an ethical issue. So the CERSAC has to present annual report where they present a number of factors, things that they do, activities carried out, the recommendation or conclusion of the CERSAC evaluation, the list of research projects examined, a list of name of attendants, a list of resource person consulted, and any other information which is deemed relevant is presented during this annual report. So where are we at the moment? Yes, as you can say, we have very good ideas, yes, but where are we with this committee? The committee has not yet been put in place, so we are still, it is not yet running, what I want to say, but we want the validation by the different member countries of CERSAC, which are also going to look into it and also see if they bind to this situation, to this committee. But the mandate has been given to CERSAC to go on with this and to make sure that we have the necessary, this committee which is running.